Our next speaker is Dr. Shraddha Makwana. She has done her bachelor's of physiotherapy from CM Patel College of Physiotherapy and has just passed in 2022. She is an aspiring physiotherapist and has interest in musculoskeletal physiotherapy. I would like to invite her on the dais.
Good morning, everyone. I'm going to present physiotherapy for frozen shoulder. So, first of all, what is frozen shoulder? Frozen shoulder is a common disorder that causes pain, stiffness, and restricted range of motion. The resulting disability can be serious if it's not treated, and it's affect mainly people after ages 40 to 60 years, and women are more affected than men. These are the causes of the frozen shoulder. Now, there are three stages of the frozen shoulder: freezing, frozen, and thawing. First one is very initial stage, in which patient having more complaint of pain followed by restricted range of motion. Second one is a frozen more developed stage, in which patient having complaint of more restricted range of motion but pain is in reducing mode. And third one is a thawing, which is a recovery stage. So what are the chief complaint of the patient? So main complaint of the patient is a pain. Patient having complaint of activities of daily living like hair combing, shirt wearing, overhead activities. And patient having more complaint of the sleep disturbance during night due to pain, and restricted range of motion due to stiffness or pain. So what is the rehabilitation approach? So first we are targeting to pain. We are starting with the cryotherapy. Cryotherapy stands for the ice pack. We frequently use ice pack over the painful area, so it's reduce the inflammation and reduce the pain. We'll use hot pack over the painful area, so it's reduce the blood circulation. Interferential therapy will use for more muscular part is involved, and ultrasound therapy will use when we have to heal our tissue, and TENS is for reduce pain. Now we have to improve our flexibility. So first of all, we stretch our capsule, because capsule is the more involved in the frozen shoulder. So we have to improve capsule stretching. So first figure shows posterior capsule stretch. Second one is inferior capsule stretching, and third one is anterior capsule stretching. Now we have to stretch our upper chest muscles. So first figure shows passive stretching of the pectoralis major muscle. Second one is actively stretch pectoralis major and minor muscles, and third one is actively stretch trapezius muscle. Lastly, we have to improve our range of motion. So we start with the mobilization, passive movement, assisted exercise, active exercise, and resisted exercise. So first we do mobilization, in which we give glenohumeral inferior glide for improved abduction and posterior glide for improved flexion. Now patient have to do assisted exercise, in which first figure shows a finger ladder, in which patient have to do flexion and abduction movement by using this finger ladder. And second one is patient is doing all circumductory movement of the shoulder joint by using this shoulder wheel. Third one is a wand exercise. Patient is doing all the movement of the shoulder joint by using any kind of wand or stick. Fourth one is a pulley exercise. Also in this, patient is doing all the movement of the shoulder joint by using pulley. Now patient have to do all the movement by themselves actively. First one is a pendulum exercise, in which patient have to lean over the table and do pendulum movement of the shoulder joint, like a circumductory movement, flexion and extension movement, and all the movement of the shoulder joint done by the patient actively. Now we have to improve our stability of the scapular muscles. So these are the isometric exercise for the scapular muscle. Lastly, patient is doing resisted exercise by available range of motion when patient have no more pain. So all the movement of the shoulder joint are done by using this stretch band, or they can use dumbbell as well. So by doing all this physiotherapical management, 80 to 90% of the patient are recovered from this frozen shoulder. Thank you so much.